Well, I think it's important to start by saying there's not any tools out there at the moment that are able to do that. But AI is really unique because it has this ability to take in a lot of data and learn from a lot of data in a way that a human couldn't necessarily do it. And there are obviously statistical methods out there that exist to handle this sort of thing, but they have very rigid structures, whereas AI is a lot more flexible, so it can learn in a more flexible way. So I think AI is definitely capable of learning about what your risk of relapse might be, what your risk of progression might be. And then I think, as a person with MS, that can be helpful in picking what treatment you might want to go on, especially if you're thinking about maybe like family planning and things, to know your risk of relapse and progression on those treatments.
I think that's a really good question, and I think I would kind of answer that. It depends on what AI strategy you're talking about. I think there are some tools which some people may be using already. So, for example, there are AI tools that can use, take MRI data and identify new lesions in an automated fashion. And I think some services are using those, and that's going to become more and more frequently used over the next few years. So that's probably the most mature clinical tool that we're using in AI and clinical services in MS. I think there are other things which people might not think about they're actually using AI for. So, for example, in my service, if I'm creating a patient information leaflet, I might use some quite high-level information, but then put that through a large language model like ChatGPT, just as an example, and that can produce very quickly and with very little effort a patient information leaflet directed at a kind of universal reading age, because I think a big thing that I am aware of is health literacy, and that health literacy levels in some areas of the UK are potentially quite low, and so I think we need to be able to provide information for everybody that everybody can understand. So I think that's one area where AI can be used really easily and quickly, and there are other tools that you can use to maybe it doesn't produce the information but allows you to assess the information that you produce. I think another area which we'll probably talk about in a bit more detail is we're providing a lot of data. We need a lot of data to make decisions for patient care, but that data we need to be able to assimilate that data and make it usable. And there are various tools that are about to become into proper clinical use that enable us to extract the data from clinical records and make that easily accessible for clinicians, and then that improves their kind of communication with the patients themselves. I think there are going to be lots of benefits in the long run, and I think we've talked about the use of being able to predict patient outcomes, and that's obviously going to be a massive benefit from choosing treatments and communicating with patients as well about risk and benefit. And there are other benefits in terms of improved communication, probably administrative tasks that will be better or more efficiently done with the use of AI tools. And I think there's a perception that it's going to replace clinicians and replace admin. It's not going to do that. It's going to augment our care and make it more efficient and allow us to concentrate on the stuff that we really want to do, like talking to people and offering help. An awful lot of the work I do in clinic is administrative, and I'd like to see tools that will, help me with that bit and allow me to spend more time with patients.
Yeah, I agree with all of that. I think there's like the healthcare professional side of things and allowing them to have more time with patients, freeing up their workload, as well as like radiologists helping them to identify lesions on an MRI scan, and maybe even identify them more accurately, because all they have to do is say yes or no, that is a lesion. And then I think from the patient side, having more access to clinicians because their time isn't so administrative will be really beneficial. And I think it's really just adding more tools. Like when you're looking at predicting how well you'll do on a treatment, that's just a tool that a clinician now has to use with someone who's experiencing MS. And, then the radiologists have this tool that can help them with their work. So it's just adding in tools. We're not taking anything away.
I think concerns about AI are well founded. I think there are concerns. I think we need to be very clear that the data and the information that we get out is only as good as of how we train the models, and that we have to be as careful as we can not to introduce bias, because if all the information is provided about a certain or from a certain population, then you'll only get predictions about that population. So we need to be careful about that as people developing the tools. And there are concerns about privacy and consent, and I think as a community we need to be very aware of that and be very open about it and be very careful where we're putting people's data and information. And then that we also need to be aware as people using AI that it does make things up occasionally. We've all heard about cases of it can create references, it has hallucinations. So again, I think we need to be very use these tools judiciously, and they're not going to replace humans. They're going to be an adjunct, another tool which will help us improve accuracy on some things. But just like we will have fears about completely automated cars, I think they're well founded. But that shouldn't put us off, using the benefits in a responsible way, like with any new kind of innovation, really.
Yeah, also completely agree with that as well. I think, yeah, there's so I guess to be aware of in terms of regulatory approval in the UK. So if it's going to be a decision maker, so something that would say you have to take this treatment, then that would need a clinical trial. And I don't think there's much in MS that is going to be like that at all. Whereas things that are just tools that are supporting, they don't necessarily need a clinical trial, but they do need a lot of supporting evidence. They need regulatory approval from NICE and EMA. So there are barriers in place to make sure that tools that aren't beneficial aren't getting into the clinic. And yeah, privacy is always going to be a massive concern. I think everyone being aware of what their data is being used for, that sort of transparency is going to be really important. And I think in terms of hallucinations and AI making things up, sort of having explainable AI is probably going to be really important to that. So if you understand how your model is making a prediction, then you can sort of keep it in check and make sure that it's only using factors that you would like to be included, and it's not using if someone has a pet as a predictor for relapse. So yeah, I think there are barriers in place, but we've got to be open and honest about them.